at a right point, that in media, bad news is a good news. So they always have been working that any hospital, anywhere, if some problem is there, some challenge is there, they will highlight and blow it apart to so big a level that all the good work which has been done, it obviously goes into oblivion. So I think the media should again learn that respond, don't react, please. And then sensitivity, responsibility. They should behave in a responsible manner. And then they should always highlight the positive impact which the hospital, the doctors or the other younger colleagues, they are having on the society. Most of us, most of the media people, most of these people have started believing that only negative things are happening all around. I think one has to change the attitude, and if you think that you are making a positive impact, that will be highlighted, that will be accepted very well. But if you are again and again thinking about negative, I remember one thing. One of the teachers gave a white canvas to the people, and then he invited the students to write an essay on the canvas, white canvas which was there. And there was a small black dot on that canvas. And would you be surprised, out of 40 students, 39 had written only about the black spot.
Yeah, that's true.
And there was only one student, and he was a positive student. He wrote so much about the white screen, that so much of white, so much of purity, so much can be done. So what I mean to say that we should not focus on negativity. If we are focusing on negativity, then this will have a ripple effect, and that will obviously harm the society more rather than only the doctors.
So ultimately, the society is going to suffer the consequences.
Exactly.
So very rightly said by you, if media could actually verify the details, or at least hear both the side of the parties.
No, I would not agree. Media should not be judgmental.
No, it's not about judgmental.
It is not a
What they are
judgmental.
broadcasting is heard and read by people, and they blindly believe what media writes. So if media is able to check the details with both the parties and listen to both the parties, and then they make their news, I think it will be more balanced kind of a news, and people will get to see the situation on both the sides.
I would say that again it is a question of sensitivity, it is a question of responsibility, and one has to justify one's role. So media also has a role. I am not denying that aspect, but do it responsibly. If you are doing it responsibly, then you are not working on your TRP. If you are working on your TRP, then you are obviously having a competition. There should not be any competition between A agency and B agency. So it should be that we believe on truth, and truth must prevail, and truth is only one.
And I think ultimately the long-term objective of any profession is to bring harmony to the society.
Exactly.
And if we are creating chaos, I think we are not doing any good to anybody.
True.
I think it's not a very...
It will always bounce back.
It will bounce back, that's true. So ending with a very, important question, what is your message to the society? Because ultimately it is the society who needs to take a call. Do they want to continue with chaotic situation that we are experiencing now? Or do they want to correct it? And the responsibility to correct does not lie only with the medical professionals. It's both ways. So both the parties have to somewhere come forward, take responsibility that, okay, this is what we need to bring change in our way of working. And of course, the medical professionals also need to work on their way of, behaving with the patient or working with the patient. So what message would you like to give to the society?
I will tell you a small story. And the story is that one of the person was standing at the seashore. And as the waves would come, many fish would come out, and many fish would die, and many fish will go back into the sea. So this man, he was picking up the fish and throwing it back into the sea. And somebody objected, "What are you doing?" He said that, "I am making a difference." So he said that, "How are you going to make a difference? So many fish are coming, so many fish are dying, and so many are going back. So how can you make a difference?" He says that I am making a difference in the life of that fish which I am throwing back. So what I mean to say that all of us should never ever think that once the government becomes uncorrupted, once the politicians become uncorrupted, once XYZ media also is okay, then only I will be honest. Otherwise, I will not be honest. I think we have to be honest to ourselves, and then we should try to make a difference in the life of persons which we are touching. We are touching lives, we are touching human lives, so we should be able to do this with truest earnest feelings, and then only it will make a difference. Please do not expect from government, from bigger hospitals, from all the doctors. You do your job well. So if the society also starts reciprocating that kind of faith or trust on each other, then it will make a total difference in the fabric.
So somewhere I think society has a very important role to play by understanding that there are limitations in every profession. So we can't just generalize that everybody is wrong or everybody is correct. There are good people, there are bad people. So when you are making a statement of this kind, you need to really see the person in totality.
True.
And see the actions of people rather than just making a person, good or bad. So similarly, we have good doctors and we have doctors who are, not that good or not, really very honest. But we can't generalize that every doctor is a corrupt or bad. So with this, I think we come to the end of the discussion. It was a pleasure interacting with you, and I'm sure this discussion will go on in the future episodes as well. We'll pick up many more topics relevant to healthcare communication, where we really want to bring a change in the situation by interacting with people like you and many more who are experienced and knowledgeable and would really benefit the society. Thank you so much for talking.
Thank you, Dr. Indu. I think the story which I told at the end, it holds true to you also. That you are trying to make a difference, and you should carry on this kind of making a difference in the lives of the people. You should never ever think that will it be a mega difference or a small difference. It is a difference. So once we have small steps, baby steps, then or small bricks, then it will make a big wall. So we should carry on making small baby differences, and it will become a mega difference. Thank you very much. God bless you.
Thank you so much.